When you look at partners in health, our patients are our bosses. We don't take those kind of relationships for granted because we know without patients, we don't have job, we don't have anything that we can do. As lab colleagues across the One PIH network, we serve the patients.
At Partners in Health, we support over 26 laboratories in 9 different countries, where we provide lab testing as common as clinical chemistry testing to CBCs. We also provide more specialized diagnostic services such as pathology lab, microbiology lab, in addition to molecular biology lab capacity.
I see the lab to be the center of all the health system programs that we'll be doing in this country. Your country health system is as strong as your lab. If you have weaker labs, you have weak health systems. If you have strong labs, you have strong health systems.
First and foremost, lab testing provides accurate and reliable test results so that the clinician can have an information-based decision on diagnosis and treatment. Without that, your clinical decision-making can be compromised, which can lead to implications for our patients that are life-threatening or potentially life-ending. One of the largest and systemic challenges the lab faces are infrastructural. Access to reliable electricity, plumbing infrastructure, transportation systems, especially in the rough terrains where a lot of the PIH-supported labs and health facilities reside in the rural areas. Lesotho faces the significant challenge of extreme terrain. It would take over 15 hours by road, boat, and hiking for a specimen to be sent to the lab. We have invested in what we call mini labs with lab technicians, lab equipment, and testing there at the site, so we're no longer having to send out tests to the capital.
In Liberia, the nearest lab that Gigi does could refer sample to for microbiology testing. In the rainy season, sometimes it takes a week, so that makes it very impossible if you have a critical patient that needs care. So with this lab being established, we're going to reduce the turnaround time. Instead of 2 weeks or month, we're going to be reporting like within a day.
At Partners in Health, we are investing in microbiology labs. Microbiology labs serve an important role in addressing antimicrobial resistance, which is a global phenomenon of great concern. We do not want to be prescribing treatments to patients that at best are going to be ineffective, at worst exacerbating antimicrobial resistance.
It's very unique to have a microbiology session in a hospital. It plays a very crucial role in curtailing antibiotic resistance.
Establishing a microbiology lab can be difficult because it's a fairly specialized lab. It requires instrumentation and analyzers to perform the testing, and it requires specialty trained staffing with knowledge of microbiology principles.
Gigi Dawson Lab is growing on a day-to-day basis. So one thing, we need more resources to be invested when it comes to manpower career development.
If you look at our approach in health system strengthening across the world, we use the 5 S's, which is the staff, stuff, space, systems, and social support. So staff is one of the key components. So training future generation of healthcare workers to take over where we are doing right now is one of the key components of what PIH is doing. We need local clinicians, local lab staff, local pharmacy staff to ensure we are able to upgrade their skills to work with all the systems and the platforms and the technology that we are getting in.
We want to provide our patients with the quickest, most reliable, most current form of testing available that is there right when they enter the health system. Without that, we're not doing full justice to our patients, our bosses, in providing the best possible quality of care that can be provided.
I'm here, I'm a Liberian, I have my family here, and I have people here who need me. So when you are doing the quality work, you have to save your people. Not only then, you also have to save yourself. Because tomorrow, if I'm sick, you're going to treat me in Gigi Dawson. If Gigi Dawson lab is not capable, is not qualified of diagnosing my test, what's going to happen to me?
In the next 5 years, I see a lab that has the capacity to handle any bug in terms of outbreak. And we are working towards that to ensure myself, collectively with colleagues across the African region, to ensure we change that dynamics, to ensure lab is being put at the hub, at the pinnacle of any discussion in terms of health system strengthening in Africa and in the One PIH network.